Welcome, my income Professor. I am back with another YouTube video. Let's jump right into this video. This topic, PPE, is very much important for your examination. So let's jump right into the topic. The question is, what is PPE? A PPE is a personal protective equipment. Personal protective equipment are the equipment we wear in SPD department because we are dealing with contaminated instrument. And where do we wear this PPE? We wear this PPE in the decontamination area of the department. Personal protective equipment. Like I said, we wear it in the decontamination area. So, in the decontamination area, we deal with contaminated instruments that have been used from the OR and have been sent to the department to decontamination. So that's why we wear PPE. So if you're dealing with contaminated instruments, you don't know which microorganism you are dealing with. So you have to make sure and protect yourself. So before any SPD enter into the decontamination area, whether you are a visitor or you just came in past through, you have to wear your PPE before you can enter into this department. Without the PPE, we cannot allow you to enter into the decontamination area. So next, we'll talk about the dress code. What is the dress code for PPE? For our PPE dress code, we have a flu-resistant dress code. So any PPE that we put on in decontamination area, it has to be a flu-resistant. The reason we need a flu-resistant dress code is because when we're spraying down instruments in decontamination, let's say we have an instrument that came from the OR or bloody up, we have to spray it down with water before we put it into the sonic. So if we have a contaminated instrument that have blood and tissues and bones on them, we have to spray it down. So if you done the work of flu resisting down, your whole body going to get soaked with water, and then you can even catch infection from that. So that's why every dress code, every supply for the PPE have to be a flu resistant to protect us from getting infections, to protect us from getting in contact with the fluid, with the blood, with the blood-borne pathogen. So that's why we wear the PPE. So what are some of the PPE supplies? We have shoes cover. So the shoe cover, we're going to put it on our feet to protect our shoes from getting wet. Next, we have gloves. We wear our gloves to protect our hands from getting direct contact with the instruments. Next, we have our gown. The gown is going to cover us from neck all the way down over our shoe cover. So it protects our front from getting in contact with any fluid. Any fluid that touch the gown, it do not penetrate because it's a flu resistant gown. It protects us from every liquid. Next, we have eyes protection. Our eyes protection protect our eyes from any flash that may come on our face. It protects our eyes so it can get like through in contact with our eyes. And next we have our face mask. We have our face mask. Our face mask help us protect our nose, our mouth from getting for the fluids getting back into our mouth or our nose. So this, and also we have a face shield. So we wear a face shield over everything before we begin the process. So these are some of the flu resistant supplies that we have that we that we have that we wear before we enter into the decontamination area. So remember keywords: personal protective equipment protect us from microorganisms. It protect us from any body fluid and then body tissue that we may come in contact with. Like I said, the PPE protect us from the body fluid. So it protect us from PPE protect us from blood from the patient. Yes. So the PPE, it's so the PPE protect us from blood, body fluid, blood-borne pathogen, and some other contamination at items. Remember, you can replay this video over and over to make sure you understand your PPE and how it is very, very much important for you, the sterile processor, to protect yourself from all these blood-borne pathogen. Now let's jump right into this practice question after all the explanation. The question said, personal protective equipment is required in decontamination and sterile storage area. We have A, true, B, false. So what would be your right answer? Your right answer here would be B, false, because personal protective equipment only being wear in the decontamination area. The sterile storage area is where we keep all instrument that is sterile, that is clean, that is ready for use, that we just waiting on the OR to request the instrument so we can take it to them so they can begin the surgery. But the decontamination area is where we do all the cleaning process. Thank you for tuning in today. Remember, I have our ebook exam style practice question in my bio, and I also believe that you can study and pass the examination. I believe in you and you should believe in yourself. Bye-bye. Bye.